So my name is Reg Armfield, and I have wet macular degeneration in the right eye, and I've had macular degeneration in the left eye, which is now I only have peripheral vision in that eye. The treatment is to have injections into the eyeball.
My name's Dr. James Neffendorf. I'm the Retinal Research Fellow here at King's Hospital. I work for Mr. Tim Jackson, who's one of the consultant retinal surgeons. Anti-VEGF treatment is injections into the back of the eye, which can be used in a number of different eye conditions in order to improve the central vision of patients suffering from those conditions.
I come into the hospital once a month. They give you a thorough eye test, then they put drops in the eye, then you proceed to an electronic scan where they take a horizontal picture of the retina. That you see the doctor, he does an eye examination, and then he decides whether if you've got fluid in the eye, you'll have an injection. Well, as I understand it, the treatment is to have injections into the eyeball with the fluid, which dries up the fluid that leaks from the back of the retina.
The drug itself is targeted against a protein which is involved in the abnormal growth of blood vessels. If you can improve the bleeding or the fluid, then you are able to improve the quality of vision that the patient has.
Well, I think that when someone says that they're going to inject into your eye and you've never had it done before, then it must be quite frightening, and that to a lot of people it must be horrific. But in actual fact, the actual injection is a complete non-event.
We numb the eye, and the patient doesn't usually see the needle.
When it's your turn, you go into the operating theatre, you lay on a bed, they then clean the face, clean the eye. There's no pain, and it's over very quickly. The only after effects is that you sometimes get like a black ball which hangs around, but that dissipates in about 24 hours. I went on to this new drug, and I've had 3 of those, but the first injection seemed to dry the eye up, and it's been dry for the last 3 months. I'm now playing bridge, not saying I'm playing it better, but I'm playing it a lot easier, and I can see the cards a lot easier, so there has been an improvement with this last treatment I've had. For more information about anti-VEGF, visit rnib.org.uk and search for anti-VEGF.
RNIB, supporting people with sight loss.